Hi, it's Patrick Hutzel from intensivecareathome.com.au, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomy by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I evaluated the 3 mistakes intensive care units constantly make but they are unaware of when they are looking after long-term ventilated adults and children with tracheostomy. You can check out last week's update by clicking on the link below this video. In this week's blog, I want to bring to light long-term ventilation with tracheostomy and intensive care, the emotional price patients and families pay. Long-term ventilated adults and children with tracheostomy in intensive care have a high price to pay when it comes to their physical and emotional well-being. And I don't mean the $5,000 per day that it costs to keep a patient in intensive care. I am talking about the suffering, the vulnerability, the lack of privacy, the lack of dignity, and the lack of control that are inevitably attached to the intensive care environment. Long-term ventilated adults and children with tracheostomy pay a very high emotional price to be dependent on life support and to be dependent on other people's professional expertise, whether it be intensive care doctors or intensive care nurses. The families of long-term ventilated adults and children with tracheostomy pay a high emotional price as well. They spend day and night in intensive care to be with their loved ones. They are frustrated, they live in constant fear, and they feel extremely vulnerable by being dependent on other people. The families of long-term ventilated adults and children with tracheostomy basically have put their lives on hold as well. They often take unpaid time off work, and they often neglect their personal and family life as well. Having worked in both environments, a clinical intensive care environment and an intensive home care environment, one way to ease the emotional burden for long-term ventilated adults and children with tracheostomy and their families is to think outside of the box and do what has successfully been done in many European countries for more than 15 years and do what is natural, holistic, and patient and family focused. Intensive home care is natural, holistic, and family focused, and it's a no-brainer for anyone who has worked in the field and anyone who has seen how patients and their families blossom once they are in a non-clinical, non-sterile, less regimented and safe environment. Intensive care at home can ease the emotional burden for long-term ventilated adults and children with tracheostomy by offering a tailor-made solution for our clients, and it's a tailor-made solution for your intensive care unit as well. You can free up a bed and you can focus on looking after patients with high acuity needs and do what you do best. We do what we do best, which is looking after long-term ventilated adults and children with tracheostomy in their own home as a genuine alternative to a long-term stay in intensive care. Modern business solutions are all about creating win-win situations, and intensive care at home has created such a win-win solution in this niche area. What are your thoughts about the emotional price long-term ventilated adults and children with tracheostomy and their families are paying? Leave your comments here on the blog or send me an email to patrick@intensivecareathome.com.au. Please also note that Intensive Care at Home has been selected as a preferred provider for Queensland Health Services as part of the recent Hospital in the Home tender. You can also contact me on 041 094 2230 if you want to know more about how we can help you, your intensive care unit, or your family member who is in intensive care. Thank you for tuning into this week's blog. This is Patrick Hutzel from intensivecareathome.com.au, and I'll see you again in another update next week.